Hereby, I open this academic ceremony at Maastricht University. Well, first of all, I welcome the candidate of today, Mrs. Joyce Hayek, and she will defend her academic thesis, Effects of Health Behaviors, Social Cognitions, Demographics and Parenting Styles on Academic Achievement of Lebanese Youth. I welcome all the members of the degree committee, and in particular, the three supervisors. First of all, Professor Hein de Vries. He's professor in health communication at Maastricht University. Dr. Francine Schneider. She is assistant professor at the Department of Health Promotion, also at Maastricht University. And the co-supervisor, Dr. Maya Dweni. She is assistant professor and researcher of nutritional epidemiology at the Faculty of Sciences and Public Health at Lebanese University in Lebanon. And of course, I welcome all the followers of the live stream. Mrs. Hayek, may I invite you to give a summary of your thesis? Please go ahead. The floor is yours.
Thank you very much. Good afternoon. Dear Pro-Rector, members of the committee, dear supervisors, family, friends, the audience. In the next 15 minutes, I will present a short summary of my PhD research entitled Effects of Health Behaviors, Social Cognitions, Demographics, and Parenting Styles on Academic Achievement of Lebanese Youth. Academic achievement is important with regard to different perspectives, such as for individuals and societies. On an individual level, academic achievement has been consistently found to positively influence opportunity for future employment, a higher income, and a better health. Beside the relevance for an individual, academic achievement has been linked to higher chances for a positive socioeconomic development and is thus also important for the wealth of a nation and its prosperity. For these reasons, research has been looking at determinants of academic achievement and ways to improve it. So this is why large-scale international studies on academic achievement have been conducted to guide the development of policies, strategies, and interventions supporting educational improvement. If we look at the performance of Arab countries on international assessments of academic achievement, Arab students do not perform well in comparison to students around the world. In all three of the largest and most important international students' assessments, Arab countries have some of the lowest results and score below the international median. For example, in the latest PISA, the Program for International Students Assessment, which is a global survey assessing the performance of 15-year-old students in reading, math, and science, Arab countries had poor learning outcomes and ranked amongst the lowest. As we can see in this map of countries, presenting a ranking of the countries that participated in the PISA of 2018, countries in red are the worst performers, and all 6 Arab participating countries are in this category, not reaching the international benchmark. The latest round of the PISA also showed that 5 out of 6 Arab countries are in the bottom 1/3 among the 79 participating countries, with Lebanon having some of the lowest scores in the 3 areas of reading, math, and science. In Lebanon, opinion surveys assessing the overall perception of education showed that the majority of respondents had a positive opinion about education quality and outcomes. However, this positive perception does not reflect the reality of the sector in Lebanon as measured by learning outcomes. Lebanon's performance remains far below most countries in the Middle East and the rest of the world on international students' assessment across both public and private schools. For example, results from the TIMSS, trends in international mathematics and science study, which is also a large-scale standardized assessment administered globally and in Lebanon, and which assesses the level of performance in math and science, indicated that learning outcomes for grade 8 Lebanese students have been significantly decreasing since 2007, and the gap between Lebanon and the international average has been widening. Lebanon's low performance compared to the international average was also demonstrated through the PISA results. The latest PISA of 2018 showed that there are differences of more than 3 to 4 years of schooling between Lebanese students and other students. Performance in reading was especially low. Actually, in reading, Lebanon was the worst performer among all participating countries. PISA results also highlighted alarmingly low levels of proficiency in math, science, and reading among Lebanese students. In all three subjects, roughly 2/3 of Lebanese participating students did not meet the basic level of proficiency. In addition to low mean scores in reading, math, and science, Lebanon had a high dispersion rate. Dispersion rates measure the difference in scores between the top and bottom performers. And thus countries with high dispersion rates are countries where inequity is high and where there is a large gap in learning achievements between students. And so results point also to Lebanon being among countries with the widest gap in achievement between top and bottom performers. So the significant disparities in educational outcomes between Lebanon and other countries and Lebanon's low performance point to a learning crisis and highlights the need to study which factors are associated with academic achievement and which factors could be influenced in interventions. If you look at the literature, there is very little evidence available on academic achievement of Lebanese youth and factors affecting it. Hence the importance of investigating potential determinants to inform the development of evidence-based interventions that are also culturally appropriate. This research aimed at exploring the following among Lebanese adolescents. First, we wanted to identify the most important factors associated with academic achievement of adolescents in Lebanon and how changes in those factors influence change in academic achievement after 6 and 12 months to better inform intervention strategies. Additionally, and since parenting styles have been found to influence academic achievement as well as factors affecting achievement, this thesis aimed to examine the socialization practices in the Lebanese cultural context and how parenting style might affect academic achievement, but also to examine the influence of parenting style on determinants of academic achievement, such as health behaviors and social cognitions. In addition, this thesis aimed to examine the integrated effect of parenting and social cognitions on academic achievement of adolescents in Lebanon. This research followed a longitudinal design with 3 measurements 6 months apart and was conducted in 2 areas in Lebanon, Beirut, the capital and largest city, and Mount Lebanon. These 2 areas were selected because they concentrate the majority of the Lebanese population, including approximately half of the Lebanese students, and are representative of the various religious and socio-demographic societies in Lebanon. Using a stratified sampling design, 10 schools were randomly selected from the Ministry of Education's list of public and private schools in Beirut and Mount Lebanon. From the 10 schools approached, 7, 3 public and 4 private, agreed to participate in the study. From these schools, all students from grade 10 and 11, aged 15 to 18, were invited to participate in the survey, resulting in a total baseline sample of 600. Students individually completed the questionnaire by hand inside their classroom. The survey collected information about sociodemographics, health behaviors, social cognitions, and parenting styles. Trained dietitians were present in the classroom at all times for any clarification and support, and to measure students' height and weight using standardized procedures and calibrated equipment. This research consisted of 4 studies. The first study was cross-sectional in design and examined the association between sociodemographics, health behaviors, and social cognition with academic achievement of Lebanese adolescents. The second study was a longitudinal study and investigated the prospective influence of parenting styles on health behaviors, including diet, physical activity, smoking, alcohol intake, and BMI of Lebanese adolescents over a 6-month period, and the moderating effect of adolescent characteristics such as gender and age. The third study was also a longitudinal study and examined the relation of parenting styles with sociocognitive beliefs about getting good academic performances and academic achievement over a 6-month period. In addition, the study examined the mediating effect of these social cognitions and the relation of parenting with academic achievement and the potential moderation of adolescent and parental characteristics. The fourth and final study was a longitudinal study with repeated measures and investigated how changes in health behaviors and motivational factors affected changes in the academic achievement of Lebanese adolescents at a follow-up after 6 and 12 months while controlling for socio-demographics and parental styles. The key findings of our research are as follows. First, we found that adherence to the Mediterranean diet and academic efficacy beliefs were prospectively associated with better academic achievement over a 1-year period. Specifically, academic achievement of adolescents improved with increased adherence to the Mediterranean diet and higher efficacy beliefs. With regards to socialization practices, authoritative parenting was the most reported parental style, followed by the authoritarian style. The authoritative parenting style was significantly associated with higher adherence to the Mediterranean diet and a lower intake of alcohol after 6 months. This parenting style, the authoritative parenting style, was also prospectively associated with higher academic self-efficacy, stronger intentions to get good grades, and a better academic achievement at 6 months follow-up. So when looking at the direct association of parenting with academic achievement of Lebanese adolescents, our results showed that authoritative parenting had the most positive influence on academic achievement compared to all the other styles. In addition to the direct effect, our results revealed the indirect mediated effect of parenting on achievement via the sequential pathway of self-efficacy and intention. So adolescents of authoritative parents were more likely to have high academic efficacy beliefs, which in turn influenced stronger intentions to achieve good academic performances and subsequently influenced a higher academic achievement. With these results, we were able to conclude that adherence to a healthy dietary pattern and high academic efficacy beliefs are important factors positively influencing academic achievement of Lebanese adolescents. Parents are a major source of influence and affect several adolescent outcomes. Authoritative parenting is the most commonly adopted parental style in Lebanon and positively predicts higher adherence to the Mediterranean diet, lower alcohol consumption, higher academic efficacy beliefs, stronger intentions to get good grades, and a better academic achievement. The findings of this research allowed for a better understanding of the main determinants of academic achievement of Lebanese adolescents and filled a gap as to the evidence from Lebanon. The findings of this research can help inform the development of strategies, policies, and culture-specific interventions to improve academic achievement of Lebanese youth. The findings of this thesis contributed to expanding the knowledge on socialization practices in the Lebanese context and its effect on different youth outcomes, including health behaviors, social cognitions, and academic achievement. Intervention aiming at improving academic achievement in Lebanon should use a multi-component approach targeting adolescent eating behaviors, academic efficacy beliefs, and parenting styles, and involve multiple stakeholders, including school personnel, parents, and adolescents themselves. We recommend that future research be conducted on a national, more representative and bigger sample, and include domain-specific parenting practices, among other variables, to follow experimental designs and to be conducted for longer periods of time to confirm and extend the current findings. With this, I conclude and give the word back to the prorector.
Thank you very much, Mrs. Hayek, for your clear presentation. The opposition will be opened by Professor Nanne de Vries. He is professor in health promotion and education at Maastricht University, and he is also secretary of this degree committee. Professor Nanne.
Thank you, Pro-Rector. Dear candidate, first I would like to share my appreciation and of course my compliments for the work that you've done. I know something about the situation in the Lebanon. Maybe you started before all the unsettling circumstances came to be, but still, you know, in view of the economic, political and social situation, it is really amazing what you've accomplished over the past few years. And I would like to extend, of course, these compliments also to your supervisors. And there seems to be something with dietitians in the Lebanon, because we meet quite a lot of those here in Maastricht, and they all present theses that are very good of quality. So thank you for that. Now, my first question that I would like to discuss with you concerns the parenting styles. Because we see that the authoritative parenting is the most common style, and that is based on a median split method that you use in after having asked for demandingness and responsiveness. And I would like to discuss with you this median split method, because it might mean that people are not demanding at all, but are simply in the bottom or the upper half of the distribution that you have on this variable. So authoritative then means something that is very, well, let's say, flexible. So to get a better picture, I would like to ask you what would be the absolute level of demandingness, and indeed if authoritative persons, parents are authoritative, or that they are just a bit less authoritarian or neglectful or whatever. Could you say something about this, please?
Yes. First, thank you, highly esteemed opponent, for your compliments and for your question. I would first like to say that when it came to deciding how to categorize the 4 parenting styles, we really discussed this, and we were thinking about following the median split approach or versus the tertile approach, or even just examining the dimensions independently, and so the dimensional approach. And so actually studies, they vary in the choice of whether the median, the tertile style, the category approach, or the dimensional approach. And there is no right or wrong way of doing it. There are some advantages and disadvantages to the different methods. Mm-hmm. And so first, I just want to explain that we chose the median split approach to first maintain the more complete sample and to increase power. And actually, the process of using a median splits in the parenting literature, it is based on a substantial body of research, and it allows for a direct comparison of results between different studies.
Can I just interrupt, because this is exactly the point. Because if you can compare between different studies, it also means that you can put the numbers that you get from the two dimensions in an international context. And then it might appear that in the Lebanon, every parent scores very low on demandingness or on responsiveness. And that is exactly what I'm informing about. So about the absolute level of those variables.
Yes, so exactly what I wanted to say, that the limitation actually of this method is that we are trying to draw boundaries between the different groups, which is maybe a disadvantage. And for example, in the dimensional approach, we are able to examine the independent effects of each of the parenting dimension with the outcome. But I think that in the category approach, it makes it possible to examine how unique combinations of parenting dimensions, they work together in predicting adolescent outcomes. Whereas in the dimensional approach, it does not take sufficient account of the multidimensional and interactional nature of human behavior.
Okay, well, just to press on one more time, because I see that, or you also report in your summary that the authoritative and the authoritarian, no, so the authoritative is the most common, and then the authoritarian is the one but most common. And actually they are under the same level of demandingness. So the median split does not really actually work, because if there would be a median split, then 50% of the persons would be in the high demanding category. But actually it is more than 60%. Do you understand what I'm trying to say? That median split is a method, but that is, of course, you know, everything can move up and down on the scale. And that was why I was informing for the absolute level of demandingness, whether this indeed was high for those people in those two categories, or that it was just not so very low.
I think that it was just not so very low, and I do understand your point of view. And again, maybe examining those dimensions independently would have been better, but we actually made the decision to draw some boundaries based on the median split.
Okay, thank you. Do I have another minute? Because another question that I would like to raise is about the role of self-efficacy. In the discussion of the longitudinal chapter 5, you devote about a page in explaining why higher self-efficacy might lead to higher academic achievement in a longitudinal way. And you give about 5 lines to the reverse or inverse causality that higher self-efficacy might lead to higher achievement. And I would propose that you should have reversed, let's say, the attention that you give to both causal pathways, because I think the last one is more probable than the first one. What do you think about this?
Thank you, a highly esteemed opponent, for this question. I do agree. And actually, when I was trying to explain the positive influence of academic self-efficacy on academic achievement, I try to explain it by this bidirectional relationship between efficacy beliefs and academic achievement, which actually pertains to the one of the sources of academic efficacy, which is the mastery experience. And so this is why I try to explain that self-efficacy is a stronger predictor on the longer term because of this reciprocal association. So when adolescents, they see that their hard work and their persistent and effort is paying off by them succeeding academically, this will further increase their efficacy beliefs, which in turn will positively influence their academic achievement.
Thank you. We fully agree on this. So thank you very much for your answer. I'll give the floor back to the project. Thank you.
Thank you very much, Professor de Vries. The opposition will be continued by Professor Lechner. She is a professor in health psychology at the Open University in Heerlen in the Netherlands. Professor Lechner.
Thank you, Prorector. Dear candidates, First, I would like to start with compliments for a well-structured thesis with an interesting series of relevant studies. Your topic, academic achievement among Lebanese youth, is indeed a relevant subject. And it resulted in 4 papers with a broad focus on different determinants and factors related to achievement. And you also looked at processes of influence, moderation, mediation, which proved quite relevant. So all in all, it's quite impressive to read, and I would like to give my compliments to you, but also to the team of your supervisors for a job well done. But of course, I'm here for asking questions, and I'm honored to do so. Well, first, I have some issues concerning the method you used in your research. If I look at the results in your study, I see that nutrition or diet quality proves a very relevant factor or correlation in almost all your studies among students. It is linked positively to academic achievement, but also to authoritative parenting styles. So in all studies where lifestyles are included, you find strong relation with diet quality, while the relation with other lifestyle behaviors are less clear in the different studies. So if I look at the study procedure, but also at your background, I see a clear, what I would call nutrition footprint. There are trained dietitians who visit the schools to administer the questionnaires, and I suppose that they were also introduced as such. Further, there was also a lot of intention to rate, etc. And this dietitian would read aloud all questions and answers in the classroom. So there was a lot of attention for diets in the research. Could it be that students were somewhat influenced by this procedure? Or in other words, could they have perceived from the procedure that it's probably very important that diet quality and diet is important in the study? So could this, for some part, explain your strong results? So my question to you would be, could you elaborate on the research procedure and if this might have influenced the results with diet?
Thank you, highly esteemed opponent, for your compliments and for your question. This might be a possible explanation, but I would like to highlight the fact that even though they were trained dietitians, first participants did not know this. They just saw them as like research assistants. And actually the trained dietitians, they were present in the classroom and read all questions aloud and explained all questions. They did not only focus on the nutrition questions or the food frequency questionnaire. So I think they gave equal attention for all questions. Now, I do acknowledge that exactly the diet quality and the nutrition variable has been consistently significantly associated with academic achievement, whereas, for example, other health behaviors such as physical activity or smoking and alcohol were not. Some were cross-sectionally associated, some were only prospectively. I don't think it only relates to the fact that of the background of or the procedure of the study. We try to explain this actually with other probable explanation. For example, for physical activity, we thought that it might have been better to examine cardiorespiratory fitness, which is a more objective measure of physical activity than self-reports. Also for smoking, we believe that it might have been better to ask more questions, for example, about the number of cigarettes smoked, and the same for alcohol, about the quantity and not only the prevalence. So I think maybe that this also played a part in not finding consistent, significant associations for the other health behaviors.
Okay, thank you. Clear. I have another question, and it's quite a different question. If I look at your discussion on page 158, you present like a final model, how influences work. So, and this model suggests that if you have a combination of a authoritative parenting style and attention for healthy lifestyle and motivational factors, that could be of large importance for creating also positive health, but also positive academic achievement among students. So that would be your final model. Well, the question then is, of course, how would you do that? And especially my question would be, the parents seem to have a very central role. They seem to be very important, especially their parenting styles. But it is also so that the parents who have what we call less positive parenting style are much harder to reach in interventions, because they might not be as interested in such an intervention. So my question would be, if you were to make an intervention, which includes the parents, you also looked at different parties, but I would like to focus on these parents. How would you reach these parents, and how would you actually motivate them to participate in your intervention?
Thank you, highly esteemed opponent, for this question. I do suggest to examine parenting styles and practices, and with regards to the interventions and how to reach them, I think I would go with a qualitative approach first, maybe conduct focus group discussions or interviews with those parents to first examine their perception. First, what do they know about their parental styles, and if they do know that it affects several of their children's outcomes, instead of just assuming what they know or they don't, and how an intervention should be. Also, I would ask them how they would like if there is a need for them to learn more about positive parenting practices, how they would like to do so, through what channels. Maybe they would like to do this through applications, online, maybe through videos, or even peer groups and classes. So I think it's very essential for such intervention to start first with a qualitative approach, and to just sit together with parents and to see according to them what to do.
Excuse me, I have to interrupt you. We have to move on to the following opponent.
Thank you.
Thank you, Professor Lechner. The opposition will be continued by Dr. Gubbels, and she is assistant professor at the Department of Health Promotion at Maastricht University. Dr. Gubbels.
Thank you. Dear candidates, I would like to also congratulate you and your team on your thesis. You have done very important work under very challenging circumstances. So my compliments. I do want to ask you some questions, and they continue a bit on the path that Professor De Vries and Professor Lechner already asked you about, because I have some questions about the parenting styles and how you assess them. Because I read in your chapters that you asked the adolescents how they would rate the parenting style of their parents. Do you think that there would be a difference if you would have asked the parents how they perceive their parenting style?
Thank you, highly esteemed opponent, for your comments and for your question. So there are many ways to measure parenting styles. From observational assessments, the global observer rating, to parents' report, and to children's report on parenting behaviors. And maybe the preferable way to measure a parenting style would be through observational assessments and multi-informant data. But this was not feasible in our case. And so we opted for the adolescent report, because it was suggested in the literature that compared to parents' reports, they were more reliable, because for parents, when they are asked about their parenting behaviors, they tend more to give socially desirable answers. And so this is one, and this is why we opted for adolescent reports. Now, if they would differ, probably, maybe, I am not sure. We would have to really conduct another survey or study. But also, I think what is important is, and for our study, is that how adolescents perceive and experience the parenting styles that we thought it has more influence and more importance. And this is why we went with the adolescent reports.
Mm-hmm. Yeah, that's very clear. But I also noticed that you asked them to give an indication of the parenting style in general for both fathers and mothers. And you described in your thesis that especially in Lebanon, there's a quite big difference between fathers and mothers, that the fathers are often more strict, more authoritative, and the mothers are more caring, show more warmth. So what do you think are the implications of the way that you chose to measure this, so that you have an average of the mothers and fathers?
Yes, thank you for this question. We do mention in our limitation that it might have been better to measure them separately to see how they might differ in their socialization practices. But I think we chose to phrase the statement with reference to both parents, because there was also this very well-known study on parenting styles in Arab countries, which examined and compared the different methods of socializations between Arab mothers and fathers. And it found that they did not significantly differ in their method of socialization. It indicated that since Arab societies are collective, so is too parenting. However, this study, it dates back to 2008, if I remember correctly. And I do think that Lebanon is a more liberal and more open country, and this might differ in the Lebanese context, and it would have been maybe better to differentiate and to measure them separately.
Mm-hmm. Yes, but that's something you cannot change anymore now. So given that you chose to assess this in this way, what do you think is the consequence of that? Would you have found different results if you would have measured them separately? Because I can imagine that if you take the average of a strict parent and a not strict parent, everyone ends up in the middle. And what are you then really measuring?
Yes, thank you. I would assume that if we would have measured them separately, that maybe mothers would be more on the authoritative part and style, and maybe fathers, Lebanese fathers, would be more authoritarian. And so this is based on maybe the culture here and how parents usually raise their children in Lebanon. Usually fathers are more strict and they are this paternal figure. So I would assume this. However, I am not really sure. Again, I think we must conduct research to have empirical and scientific evidence of this. But so if I need to make an assumption, I would say that it would be that way.
Mm-hmm. But do you think the association with your outcomes would have been different? Because you know so clearly that authoritative style was the strongest and the best predictor for good outcomes?
Yes, I think that authoritativeness, I would probably think that it would still have the same positive influence. And the neglectful parenting, actually, it would have the worst outcomes. However, regarding the authoritarian parenting style, I am not really sure, because also in Arab countries and in Lebanon, it is more tolerated and accepted. So I'm not sure, but I would assume that authoritative parenting would still have the beneficial effect on the different adolescent outcomes, and the neglectful would have the detrimental effects.
Okay, thank you. I give the word back to the proactor.
Thank you, Dr. Gubbels. The opposition will be continued by Professor Kok. He is professor in applied psychology at Maastricht University. Professor Kok.
Thank you. Dear candidate, you already got all kind of compliments that I was going to give, so I'll focus more on my question. But I think you did very nice work. I was reading your dissertation again and the propositions, and at that time I was involved in a systematic review on the, let's say, the effects of the lockdown, the COVID lockdown on people's diet and exercise and well-being and that kind of thing. And one of the conclusions that actually a number of papers did come to was that the Mediterranean diet was related to positive effects in almost anything. And some of those authors actually said, well, the solution for everything is the Mediterranean diet. And at that time, I was reading your proposition number 2, and it says more or less the same, that if we get people to eat the Mediterranean diet, that will have all kind of positive effects. In my view, that is a misunderstanding of that an association is not necessarily causation. And of course, it's more complex, but in your dissertation itself, you're not so very clear on those causality. You just say the outcome is that people have a Mediterranean diet, and the outcome is also that there are kind of other things. That means that there is an association. But in the statement, it's very clear that you see a causation. So my question is, what is the process behind following the Mediterranean diet and having better educational outcomes?
Thank you, highly esteemed opponent, for your question. First, we cannot, of course, assume causation, but I can say that because we had consistent evidence and from a longitudinal design with repeated measures, that it provided stronger evidence towards a causal association. This is one. 2, with regards to explaining the mechanism behind this positive influence of the Mediterranean diet on the better academic, the improved academic achievement, this actually could be explained by several things. First, it could be from the nutritional point of view, this dietary pattern being rich in some important and key nutrients such as healthy fats, omega-3 fatty acids, polyphenolic compounds, flavonoids, all of which independently and synergistically have beneficial effects from anti-inflammatory to antioxidant to neuroprotective properties, which lead to better cognitive functioning and academic achievement. But also, the Mediterranean diet does not only refer to the dietary pattern, but also to the Mediterranean lifestyle and the cultural context, and it includes psychosocial factors such as interpersonal and family relations, the conviviality of the guests, the families that prepare meals together and eat together. And so this is one of the hypothesized mechanism through which this dietary pattern might exert its positive influence on academic achievement, that maybe adolescents who follow this dietary pattern have also parents modeling this healthy eating pattern, and they have probably regular meals together with their families.
Okay. But I agree with what you're saying, and I understand the connection, but you're still talking about associations. It is if people have better parents, if the circumstances at home are better, all kind of things will lead to the same outcome. But that doesn't necessarily mean that there is a causal relation between all those different aspects. So shouldn't you be more careful about kind of suggesting that when people follow the Mediterranean diet, all problems will be solved?
Yes, of course not. I agree with this. And we cannot make this causal assumption. We would need to conduct like a randomized control trial to look into this causal pathway. We recommend to promote this dietary pattern because of the positive associations that we found, and because again this is the traditional cultural diets in Lebanon, and other studies are showing a shift away from this diet. So this further highlights the need to promote this diet. However, I think that this is one important factor, maybe leading directly or indirectly to academic achievement, and is not the only factor. And of course, it is not the I think the only solution to, for example, academic failure.
Okay, I understand what you mean. It's one of the, and actually you explained it better than a lot of other people did to me, so that's already something. And I understand it's much more than just what you eat. And it would actually help if the term Mediterranean diet would be explained a little bit better to people who are not accustomed to it and actually think that it's just about eating. Okay, thank you very much.
Thank you, Professor Kok. The next opponent is Professor Ruiter. He is professor in health and social psychology at Maastricht University. Professor Ruiter.
Thank you. Thank you. Thank you, Mr. Prorector. Dear candidate, yesterday I was reading your dissertation, and it was a real pleasure to read. Good writing, clear study objectives, good analysis, good reporting. So congratulations on that. And to me, the findings really made fully sense somehow. I don't know, just following up on the last question by Professor Kok. I was making a comparison with top athletes in sports, where you see that the performances increases and increases. And in the past, athletes also had a good, strong drive, intention, and they believed in their capabilities, self-efficacy. And of course, there were good trainers and coaches. So there was the good support, which is operationalized in your case by parental support. But the question raises that still, why are these athletes performing better and better over time, still, until today? And then you might say, okay, training practices have improved, effort versus taking rest, etc. But I think food plays a very important role. You see in cycling, in running, all these kind of sports, diets have improved strongly, and there's a lot of research spent on having the proper food in your body to perform well. So I would also look at maybe biological mechanisms simply, and what you said already in your discussion about the nutrients. Still, people that perform academically well might feel better, have more time, and more are more aware of the things around them, and etc. So, but that's just a side note. That was really very nice. But I have a question. Already in your introduction, you say that you try to find out, you explore the most important factors that contribute to academic performance. And I already, when I first saw this sentence, and I saw it in all the chapters almost, I was wondering from the beginning, how sure are you that you have tackled the most important factors? What I see is that you start with the I change model, and all your studies are quantitative. So you have been designing an instrument, and that instrument has been designed by you together with your team, and that has a fixed input. And you decided in advance that these will be the factors you will focus on. So what makes you think, do you still think that and believe that you have indeed explored or tackled the most important factors, identified the most important factors, we put it like that.
Okay, thank you, Hein, opponent, for your comments and for your question. So first, yes, I would like to say that the data collection activity that we did was the administration of a survey, and this survey was developed based on a review of the literature, of existing data about what are the most influential and important factors associated with academic achievements, whether in Arab countries or internationally. And so based on those systematic reviews and looking at effect sizes, we decided to include those in our survey. And so our survey included data from the literature, also questionnaires that were already validated in the Lebanese context, and we also developed some scales based on the theoretical framework of the I-Change model. And so based on this overview of the literature and the determinants and underlying beliefs that were found to influence academic achievement, we included them in the survey, and we quantitatively verified them and the relative importance of each with academic achievement. But again, I think that, of course, it would have been maybe preferable to also conduct a qualitative research, to have qualitative also data, actually to combine qualitative and quantitative data together. This would have maybe resulted in a more powerful design, or it would have also guided the development of the questionnaire. We would have a more comprehensive questionnaire, so examining adolescent perception of what are, so according to them, what are the factors that they think are affecting their performance, or what motivates them to perform better, or even to eat healthy, for example.
So do you think that this qualitative research would have given you different determinants of academic achievement? Because do you agree that you now more or less did a test of the literature, a test of what is already known, and you're more or less copying the work of others, and you make this, you bring this to a test in the Lebanese situation? Or
yes.
So and then you say, okay, and then I was hoping for that answer, that you would say, okay, qualitative research would have been good, but what would you, why would you do it? What do you think you would gain more from it than you gain from now from searching the literature and using a nice and good theoretical framework?
Yes, so first, we did test those associations, and actually this is one of our aims, is we wanted to confirm whether those associations that were found in other countries, and mainly, for example, in Western settings, they also hold true for a country such as Lebanon with a different lifestyle. And we were actually able to confirm that, for example, the socialization practices and the sociocognitive theories also apply in Lebanon. So we did want to test those. And again, we chose the factors from like the reviews of the literatures and with the highest effect size. But I do think that maybe if we would have also followed the qualitative approach, maybe we might have added more factors. But again, I just wanted to highlight a point that compared also to different studies, the added value of our study, or the plus, is that we combined all of those factors comprehensively in one design, whereas the majority of studies usually only focus, for example, on one or a few subsets of factors. And I think
I agree on that. But okay, so you now have more or less done a problem analysis. You have identified important factors. If you would now move to intervention, do you think you're already there to, are you already ready to identify the most important target points, or would you do more research? How sure are you that you have identified the most relevant target points for future interventions?
Okay, thank you for this question. Actually, in our research, we used an approach or steps suggested by the Precede Proceed framework, which is a model for planning, implementing, and evaluating health or community interventions. And so we started with the first part, which is like the precede part, which is the process leading up to the intervention and identifying the key behavioral and environmental factors. And so we did this first step, but then now we have evidence-based, scientific evidence of the factors associated with academic achievement. And I think for the intervention, we can continue with the next steps of suggested by this framework, which would be first to involve the multiple stakeholders, including adolescent, and to also, for example, identify administrative and policy factors that would
no, I'm familiar with this framework, so I think that's very good, and that needs some more research there. Yeah. Okay, thank you very much. My time is up, so I give the floor back to the prorector.
Thank you, Professor Ruiter. The next opponent is Dr. Abidi. She is postdoctoral researcher and lecturer at the Department of Health Promotion at Maastricht University. Dr. Abidi.
Yes, thank you, Prorector. Dear candidates, I also first would like to start with some compliments on your thesis and congratulations to you and your team. I think you've done an excellent job investigating this very interesting topic in depth, looking at various behavioral and environmental factors, looking at the relationships between these various factors. And I think that your thesis really contributes to understanding what, at the very least, is needed to promote adolescents' academic achievement and health, and also what factors might play less of a role. And I think that you describe really well that dietary intake and physical activity can influence academic performance. But of course, we also see a lot of unhealthy behavior at the university level, which doesn't always seem to influence or affect academic performance. So that's a bit contradictory. And we also see some mixed findings regarding different health behaviors in the literature and as well as in your own studies. So I was wondering, besides these health behaviors and the micro environment that you looked at, specifically the parenting styles, might there also be some macro environment factors, such as the political context or the economic or social context or even the legal context of Lebanon that might influence the academic achievement of adolescents? So besides of the factors that you looked at, what about the macro environmental factors and how these influence academic achievement? So what is your take on that?
Thank you, highly esteemed opponent, for your compliments and for your question. I do think that specifically now, because the research actually was conducted between 2017 and 2018, and actually only a year after the worst economic crisis happened in Lebanon, and then followed by the pandemic and the Beirut explosion. And so those multiple crises and the resulting like poverty rates and all of the issues now in Lebanon, they most probably have an effect on academic achievement of Lebanese adolescent and the factors influencing it. So, for example, for the economic conditions, I think that, and there is evidence now that, for example, parents have shifted their children from public schools, from actually private schools to public schools, because they can no longer affect the tuition fees. And for example, many adolescents have dropped out of schools to support their families. And I think that now, during this time in Lebanon, the economic factor and it would have a more pronounced and significant influence.
Sorry to interrupt you, but more, so they do have an influence, but more than the more individual factors that you've looked at. So these developments that you describe, so they might impact academic achievement. In your opinion, do they impact academic achievement more than these individual level factors? And if so, would you also include them then in a study or account for them?
I think that they would interact, that there is, I think, an interaction between the different environments that adolescents live in. So, for example, this economic condition this crisis, it might have also affected, for example, the attitudes and the efficacy beliefs of adolescents, for example, especially that for instance, in the past 2 years, the modality was switched to online teaching, and with the internet connectivity issues and power cuts, electricity power cuts in Lebanon, and the majority of the population maybe not having access to like the digital technologies, this might have also affected their motivational beliefs, which in turn might have impacted on their academic achievement. So I believe that there are maybe interactions between the different environments and that they work together in influencing academic achievement.
Okay, and so would you also say then that that would be a bit of a limitation, that they weren't included, as these macro level factors weren't really included in your studies?
Of course, it would have been better to have like to study the multiple levels, and not only the micro and the meso system, but also the macro level. We're not able to do so. Of course, we would recommend this to be looked at in future interventions, but for many reasons, from resource limitations to time constraints, we're not able to do so.
Yeah, thank you very much.
As you have heard, Mrs. Hayek, the time for defending your thesis has passed. And the committee will now withdraw to discuss the quality of your thesis, but in particular, the quality of your defense today. And please await our return with the results of our deliberation. If I see correctly, everyone is back. Yes. Mrs. Hayek, the degree committee here present online has assessed the quality of your thesis and in particular, the quality of your defense. And in view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Professor Hein de Vries is authorized to confer upon you this academic distinction in accordance with Dutch university custom and law. May I invite your supervisor to take the floor?
Yes, thank you, Prorector. We start with a question first. Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent and responsible?
Yes, I promise.
Thank you. By the authority vested in us by law and in conformity with the decision of the committee here present online, I hereby confer upon you, Joyce Hayek, the degree of doctor and grant you all rights attached by custom and law. And as evidence of this, you'll soon receive the degree certificate signed by the rector, the secretary, and the supervisor, affixed with the official seal of the university, now shown by the beadle. Dear Joyce, dear Dr. Hayek, congratulations. It's really very nice to be able to congratulate you. And I think my Arab is not that good, but I think you say tahinin. I'm very pleased to be able to congratulate you with your doctor degree. You really earned it, and you can be very proud of yourself. You started your PhD trajectory in 2016. I think you approached me by email, if I remember correctly, and then we started corresponding about how your PhD could look like. And I also approached Francine, and I'm very happy that she joined the team. And of course, also Dr. Maya Toueni was your supervisor in Lebanon. And you also got support from Bjorn Winkens. I'm really grateful for their support in this PhD trajectory. So thank you to them as well. Your topic was very interesting to me because usually my topics involve things such as healthy lifestyles and how to improve them. But the impact of health behaviors and parenting practices on academic achievement was new to me. So I also thank you for choosing me as one of your supervisors for your thesis. I learned a lot. And as we also learned during this defense, about the importance of the Mediterranean diet, it's apparently very important. We don't know yet the process, but it can be used for many purposes, I also understand. So we discussed the power issues in Lebanon and the all sorts of other issues that have come along the way. So maybe even, for the Lebanon government, it may be more important also to eat more of the Mediterranean diet in order to improve the quality of life and bring back the electricity. I don't know, but that may be your next step. I don't know. What I also learned from you and your PhD trajectory, that you are very dedicated and that you are an ambitious person who wants to learn new things. And, given your background, the world of health promotion, scientific the health promotion was something new to you, but you really became acquainted to all the challenges that brought, such a new perspective upon you. You came to the Netherlands to follow some university courses. And also you started to accomplish new challenges such as advanced statistical analysis, scientific writing. And I also wonder, you sometimes must have been sometimes bored or mad because of all the comments that I and Francine gave to you, but you always kept your nice and calm composure, and again, that how you defended today, that also showed the same really interesting attitude that you have towards these challenges. But I think the most important thing is that you managed, and you can be proud of yourself. All the 4 papers are published, and that is a very good accomplishment. You also prepared things very well, and I think that all our meetings were very pleasant. And if there were problems, we could easily discuss them and find solutions. And apart from the scientific challenges, such as the statistics, the writing, we also had other challenges, the big blast in 2020 that blew away the port of Beirut. And I remember, that blast could be heard in other countries such as Cyprus, Turkey, and Syria. But that morning I woke up and heard about it. I immediately thought, oh my dear, what's going to happen with Joyce? And a couple of minutes later, I also thought, oh, what will happen with Maya? So I was really concerned and glad to hear very soon from you that things were okay. Well, that's good. Unfortunately, our meetings were online also because of COVID-19. Traveling became difficult, and otherwise probably Francine and I would have gone to visit you and Maya to see and learn more about the context, but that was not possible. But and of course, we had some electricity problems. That's now why you're defending, your thesis in Saudi Arabia. I think that's also very interesting. But it also shows your determination to optimize the conditions for your research and also now for the defense. That really is, I think, how you are and characterizes you in a very positive way. So I'm very glad and happy that you, were able to accomplish this thesis in such a nice way. Again, congratulations to you. Congratulations also to your husband, to your family, and all the friends and colleagues that are dear to you. And with this, I would like to give the word now to Francine, who will continue.
Thank you very much, dear Joyce. Hein used a lot of words, so I again have to make it quick, but I'm used to that, because what I remember from our first meeting was that Hein and I were crammed in his office, sitting behind his desk, trying to connect to Skype, because that is what we used back in the days. And we were both competing to have our faces on camera, a thing that Hein usually wins. And you were sitting there quiet, a little shy to my perception, but also extremely motivated, and you had the broadest smile. And I would like to point out that smile because it was present throughout the entire project. It was there in the beginning when Hein, Maya, and I were giving you a lot of input, advice, instructions to get started. I can imagine it must be overwhelming, but you started and you did a good job again with that smile. And throughout the project, you also developed as a researcher. You became more proactive, and our meetings turned into scientific discussions, during which we agreed, but we also tend to disagree as a team. And I think you perfectly found your way in balancing this, seeking consensus when needed, but also deciding on your own route to take when needed. And again, with a smile. And Hein has mentioned all the barriers that we encountered in this project, but also the practical issues, collecting all data, handling the data. And also at the end, when you thought the finish line was there, but writing the final parts of the thesis took more time, I think, than you expected, because feedback was flowing very freely. You again had that smile. And my advice would be to keep smiling like that and make sure that, especially today, that smile doesn't fade. It was a pleasure to be part of the project and the team. So also thanks to Hein and Maya, but especially congratulations to you, Dr. Joyce. And this morning you sent me an app. And you indicated that you were really hoping to make us proud. And to be honest, I think you did way more than that. So now it's us that can only smile. So congratulations, and make it a good one today.
Thank you.
Congratulations, Joyce, for this beautiful achievement. I will say Mabruk in Arabic. I know that it was a challenge to do research in Lebanon, especially with the Lebanese economic crisis, the Beirut blast, and the regular power and internet cuts. It was not an easy road, but I was very impressed by your perseverance and fighting spirit. You never gave up analyzing and writing until we got satisfied. I am very pleased now that you became a very talented researcher with very good scientific skills and professional knowledge. Good luck, Dr. Joyce, with your future career. I would also like to thank Professor Hein and Dr. Francine for giving us the opportunity to improve our skills by this great collaboration with Maastricht University. Finally, thank you very much for your guidance, support, and valuable advices at every steps of this thesis. Thank you.
Thank you.
Esteemed Dr. Hayek, dear Joyce, it's my great pleasure to congratulate you with your doctorate. And I do that also on behalf of the Board of Deans of Maastricht University. And maybe I may share some impressions of the committee. Well, we enjoyed a really clear presentation of your thesis. This was very, very, very nice to hear. And of course, the study that you have done was on a topic which is really interesting and challenging, but also difficult and complex. And I think you have shown a very good and well-written thesis on that subject. And in your defense, we saw someone who is very confident, is good, is open, and also aware of literature and knowledgeable of the field of research. And I congratulate you with that. And I also congratulate your three supervisors with this beautiful result. Professor Hein de Vries, Dr. Francine Schneider, and Dr. Maya Tjueni. You may be proud of this young doctor. And of course, I would like to include in my congratulations your husbands and your parents and other members of your family, and also all those who have contributed to your studies and finally as we have seen in your thesis and in your defense today. So congratulations to you all, and I wish you a successful professional career and a happy personal life. Before I close this academic ceremony, I would like to thank all the members of the Thesis Assessment Committee and of this degree committee, and part of these committees have the same members. And I would like to thank in particular the external members and all opponents for the interesting questions and academic discussions. Thank you very much. Maastricht University appreciates your contributions. And now we have come to an end. I close this academic ceremony.